Hello everyone, am I audible and visible? Let me know, then we'll start. Am I audible to all? Let me check. Okay, fine. Hello everyone, welcome to Unacademy Future Doctors. Today we'll discuss about what to do before your medical college starts. Okay. Now, first of all, I would like to introduce myself. I am Dr. Dipti Kariya. I am MD PhD Physiology. Hi Hemant. Hello. Welcome to my class. Okay. I'm associate professor and I'm educating MBBS, nursing, physiotherapy, as well as dental and homeopathy students and MD students too. And I have more than 17 years of teaching experience. Now, let me explain in brief about our subscription. We have two kinds of subscription. One that is plus subscription. Here you can choose the best from the best. Here you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access QuestionBank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes, and with 12 months and above subscription, you can get printed notes too. Next is our iconic subscription. Here, your access to the best from two of the best, and they are Unacademy and Prep Ladder. With Unacademy, here all the features I have discussed in second, that is Unacademy and Prep Ladder with Prep Ladder, and the features are you can have clinical and integrated essentials, video lectures from the dream team, QuestionBank 3 with active guidance, system tags and more, rapid revision and snapshots, treasures in 2021 dream notes. We also have added certain features in our special classes. We made the classes interactive. We added facility of raise a hand. You can raise a hand, you can ask to your educator during the class, you can poll for the learners too. You can never miss a class as you're always notified for your class. You can get PDF lecture notes and you can access at anywhere and at any time. Now, also we have updated and highly effective question bank, which is having more than 25,000 high yield questions which are based on latest exam pattern, and also it includes detailed explanation too. These are our NEET PG September 21 toppers. Congratulations from Unacademy family. And this is our exam schedule. You can see here we have pre-test schedule as well as plus batch test schedules. Okay. Now, also we have started our Focus FMG 2022 comprehensive batch from 15 December, that is for 6 months, and target NEET PG 2022 test and discussion batch from 15 December, that is for 3 months. Okay. So you can subscribe from your mobile, either Plus or Iconic. And if you use my code DIPTI10, you will get 10% extra discount on each and every subscription. Okay. Now, today I will discuss the hot topic for all the students, that madam or sir or they are asking to their family members that what to do. Okay. First MBBS, suppose you have, as most of the students here, they have cleared their NEET UG and now you're waiting for the admission. These admissions are delayed, we know that. So you all have all this varieties of questions, that what to do, whether I should start my PG preparation, should I start reading, how to start, what to do, all this are some of the students. They may have question that whether we will get admission in MBBS or dental or physiotherapy, that is also not clear. So how can we start our studies, or how can we gear up with our studies? Okay, so these are so many questions here. Also in live chat also you can raise any of the question along with my talk. If you have any doubt, any question regarding anything that we'll discuss, I'll try to clear some of your doubts, as well as I try to give you some information that how can you improve your performance by utilizing this time which you are getting. At present, I think you are free enough, you have nothing to do. So how to prepare yourself for getting used to a for before getting admission in the first year? Either it is medical, MBBS, nursing, physiotherapy, homeopathy, dental, or anything. Okay, okay, how that we will discuss today here on this Unacademy Future Doctors platform. This is the only platform on which we are guiding MBBS students. We are not preparing them for NEET PG only. Okay, NEET PG ke classes, there are so many classes for NEET PG. You can get all the guidance. But if your base is not clear, I can say that you cannot make a good results. Okay, so let us start with today's talk. That first of all, first I would like to congratulate that you are all have cracked NEET PG. And whenever we are starting something new, we are always highly motivated. Okay, so students are also highly motivated at this time. In what terms? That we will do this thing, we will become some of the have planning for their means post PG also. I want to become neurosurgeon, I want to become cardiac surgeon, I want to become this joint surgeon, spine surgeon, and all. But because they don't know, I don't want to say that you cannot do, you can do all those things. But keep the thing in mind that whenever you are starting your journey for anything, whether you wish to become cardiac surgeon, whether you wish to become a spine surgeon or anything, each and every step, this is a step by step process. Okay, so what happens to the student? Initially they are highly motivated. Whenever we are starting any work, we are very much motivated for that. But what happens gradually, because I have 17 more than 17 years of teaching experience, so I can say that what happens to every year students, that initially they are highly motivated, they wish that madam ye pata kar denge, ye kar lenge, ye sab kar lenge. But फिर क्या होता है, because the syllabus is so vast and MBBS या dental या कुछ भी start होता है ना, तो students are not you can say oriented for first 2 to 3 months. They are not knowing what is happening. Okay, 2 to 3 months तो बुक समझने में लग जाते हैं. Clear? I'm not here to depress you, just I am telling you the fact. Okay, साथ साथ में क्या होता है, because you are away from the home so many times, so you may be homesick also. The whole atmosphere is different, you are in the whole different atmosphere. Plus second more important thing here is you have to deal with humans, not with the machines. So each and every human has different emotions, so they all interact differently. Okay, so initial tempo was very high, but gradually what happens, as the syllabus is vast, second thing is they are not getting enough guidance, homesick, they are not getting motivated also. So what happens, day by day their performance deteriorates. I'm not talking that each and every student will be having like this, but this is the common problem students are facing. Okay? And then what happens, gradually their interest decreases. So what we have to do is we have to prepare ourselves from the very first day that we have to be consistent for our work. ऐसा नहीं है कि आज हमने बहुत 10 घंटे पढ़ाई कर ली, कल कुछ नहीं किया. This won't work anyways. Because suppose आप एक पौधा है, उसके ऊपर पूरा बाल्टी भर के पानी डाल दोगे और फिर 10 दिन कुछ नहीं डालोगे, तो that will not work. So it requires sprinkles. Same thing. Gradually, small work every day, that gives you result. Okay, so don't get depressed. I'm not scaring you that this happens and you cannot do it. I wanna tell you that this may happen. This happened with so many other students before. So be aware that this won't happen with you also. Okay, suppose if we are knowing that this is risky place, so we are going there cautiously. Okay, it is not like that we are not going to get admission in the medical. We definitely, so many students, they did their best also. We will also do it, but for that we have to be consistent, we have to be hardworking. That is from the very first day. It is not like that कि मैडम एग्जाम के अगले दिन सब पढ़ाई हो जाएगी. That is not for medical studies. Okay, so this is the introductory part. Okay, second, opposite situation. Some students are getting anxious. क्या करें, अभी से पूछ रहे हैं मैडम प्री पीजी का प्रिपरेशन, नीट पीजी स्टार्ट कर दे अभी से, ये क्लासेस अटेंड करना स्टार्ट कर दे. दैट इज ऑल्सो नॉट वर्किंग. व्हाई? Because what happens, you already have studied a lot in your 12th standard, and continuously you also still you have to study for a long period of time. So if you are anxious and if you are studying continuously, then you feel that at the end of the all years you feel that now I'm getting tired, now I don't want to study. This also happened for so many students. So it is not like that from the very first year you start your NEET PG preparation. This is also not required. In first year, what is required is make your basic subjects clear. As you all know, if your base is strong, you can make a very good building. So first year, whether it is medical, dental, physiotherapy, homeopathy, Ayurvedic, any first year, all the students, they have to make their base clear. So what happens from second year onwards, if you are preparing for your PG, then it becomes easier for you because your concepts are clear. So you can easily prepare for your other. Suppose if you are not knowing anatomy properly, you cannot know surgery. Definitely, if you are not knowing physiology properly, then you cannot know medicine. Okay, so this is the way. Previously they were saying that anatomy and physiology, basically it is the mother of medicine. So now let us so now students, they ask me what to study now, madam. You are telling me not worry too much, not be lazy. So what to study? As we all know that your counseling is delayed. You are not knowing that when you are getting admission, where you will be getting admission. Okay. So most of the students, they don't know what to study and how to study. Okay. I can suggest that first you try to be familiar with your subjects. Okay? Here, YouTube is the best option for students. I can say you all people are very lucky because for getting single information, we visited library. Okay? We visited our library and we opened so many books. Here everything is available for you. So please watch the videos, different videos for first MBBS. Here I'm not favoring that I'm with Unacademy, but Unacademy has started the best initiative for first year medical student, medical and paramedical. Okay, we are posting live videos. We have our live videos daily. This is you can subscribe our channel, you can get live videos here. Okay, and at least you try to watch the video and you are getting so many information, you are getting used to all the subjects. If only you watch the video, that is also more than enough, I can say. And then another thing is try to prepare the topic. Suppose if today one teacher taught a topic of half hour, then by the next day lecture you try to prepare that topic. You read from internet, read from other videos also, you can watch other videos, you can prepare your notes also. So you need not have to go anywhere, you just have to give your 3-4 hours a day. Okay, now some of the students may say that madam, now should we start studying for 8 to 10 hours a day from the very first day? No, that is not needed. It is not like that you should start from the very first day 10 hours study. What happens at the end of the year? You get tired. So at least suppose we have 3 subjects, most all the students, just first of all I would like to say you that this is our groups of the subjects for examination in your MBBS. Okay, in first year you have to study anatomy, physiology and biochemistry. This is of 2 semester, means 6 months each semester, so 1 year. Okay, now very important thing here, if you are taking admission either in the medical, MBBS, dental, physiotherapy, nursing, homeopathy, Ayurvedic, in any of the course, because that is related to medical course. You have to study at least these two subjects are mandatory, as I told you, anatomy and physiology. So this will definitely come with you if you are there in B group and if you are have selected to go in the medical field. So don't feel that this is the channel which is posting videos for only medical MBBS. This we are posting videos for medical students, dental, and all other students. Okay, because these subjects you must have to learn. So this is, I am talking generally about first about MBBS medical. Then comes your second MBBS. In second MBBS, your subjects are pharmacology, in which you will be for first I'll explain you anatomy. You will be learn about structure, various structures of our body, like how our heart is, what is its blood supply, nerve supply, and all. Okay, same way all the structures. In physiology, you will taught about functions of all, how our heart works. It is not so easy that I am telling. It is quite complicated and so many other things we will be learning. Okay. Biochemistry, you will learn about chemical processes. They occur in our body. Okay. Then comes pharmacology. Some of the subjects are also common for paramedical courses like dental, physiotherapy, nursing, and all. Okay. So pharmacology, you will study about drugs. Which drugs for which disease. Then pathology, what happens when there is disease. Suppose if we know normal physiology of heart, now in pathology we will study what happens when this normal physiology is disturbed. So as I told you, physiology is important. If you are not knowing normal physiology, how can you know that what is pathology? Okay, if you are not knowing normal anatomy and physiology of heart, okay, and if you are not knowing what is normal WBC count, how can you say that suppose a person is having infection and WBC increases? Am I clear? Microbiology, you will study about different microorganism, which bacteria is there, which virus is there. Okay, it causes this disease and that and all. In forensic medicine, you will learn about various toxins, as well as there is another post-mortem, that is medical legal, legally important. Suppose somebody or some person is having suspicious death, then we are supposed to perform post-mortem of the person. Why is it important? Because whether the death is because of natural course or it is because of some other unnatural way. Okay, so that is done, that is studied in forensic. Okay, then final year, third year. Here in second year, you have 3 semesters of 6 months each. Okay, then final year, you have ophthalmology, that is related with eye. Okay, you will learn about eye. Okay, structure, function, and all. ENT, that is ear, nose, and throat. Ear, nose, and throat. Okay, and community medicine. In that, you will learn about prevention of diseases. Like suppose, like vaccination. Nowadays, as you know, corona vaccines are there, COVID vaccines, and that. So all these programs and all you will learn in your community medicine. This is also for 2 semesters, 6 months each. And in final year, last 2 semesters, you will learn about general medicine, surgery, obstetric and gynecology. Gynecology, that is related with the disease related with female reproductive tract, and obstetrics, that is the related with normal female reproductive tract. Okay, and pediatrics, that is related with the children, diseases in the children. So this all you will learn. Am I clear? So this is about your format. How will you learn different subjects in your different years? So now you can understand here. If you are not fine with your anatomy and physiology, what happens? You cannot be good in all the subjects. Okay, so anatomy and physiology are your backbone. So we will study here these 2 subjects first. Now, so first thing I would like to say you that, so in first year, medical, MBBS, your or dental or physiotherapy or any other medical paramedical courses. Okay, so anatomy, what is anatomy? That is something to visualize, that is always 3D. Okay, this is the reason why in anatomy you are supposed to do dissection. है ना? Anatomy में आपको dissection करवाएंगे. Okay, so you learn most of the things by dissection. Why? Because if you visualize that, actually you can see here, suppose this is your sternum, these are your ribs, huh? This is clavicle. So then you can easily understand that this structure is located here. Okay, so another important thing here is at present you are not doing dissection. Huh? You're not doing dissection. So right now, at present, before your college starts, what you do is you just focus on the general anatomy. General anatomy our madam is taking. So you can go to this YouTube, our channel Unacademy Future Doctor, and our madam Dr. Mona Lisa. She is taking classes on general anatomy, like general anatomy of bone, general anatomy of muscle, okay, and all. This is not my subject. I am not going in much detail. So you can start with this general anatomy, as well as if you can start with upper limb also. All the lectures we are providing here. Okay, so you can familiar with it. Now, second thing what I suggest is at present you can read, mainly you can focus on the physiology. It is not that because physiology is my subject, I'm not telling you for that reason. But what happens after your college starts, I have observed most of the students, because they are more busy with dissection and all, and they are giving 50 to 60% time to anatomy only. So what happens? 50 to 60% I am telling, sometimes they are giving 80% time, and they are not giving, and 20% to physiology, and not giving 0% to biochemistry. This happens. This is the ratio I have seen. Biochemistry the बच्चे last day पढ़ते हैं. Don't do like this. So at present, always you can divide your time. 50 to 60% anatomy, that is fine. Then 30% time you should give to physiology and 20% to biochemistry at least. Okay, if you are not good in biochemistry, you can give more time, that is all. But at present, why I am emphasizing that read physiology, because you don't have dissection. So what you can learn is you can learn physiology. So if you are giving some more time to the physiology subject, then your subject is clear. So when your college starts, you can, if you give less time to physiology, that is fine. Okay, you can read anatomy. Our madam is also taking, she is one of the senior faculty which we have, so she is also taking anatomy classes. You can enjoy with her also. Okay. Another thing is, this is one more thing which I found. Doctors can rightly be proud of their qualification, which is now, I just told the same thing before in my special class also, that which is now accepted as toughest course by Guinness Book of World Record. Okay, so this is not to scare you, but you should be proud that you scored such a high that you could get admission in medical field. Okay, so but this proud, to maintain this proud, you just have to work hard. There is no other option. I have seen two kinds of students. One is those who are very intelligent but not working hard, so that is not good. But some students are, sometimes I have seen some students are average, but if they work hard, they can be better than the first group. So if you are intelligent and if you are working hard, then you can think where you can reach. Okay, so this is also very important thing. Okay, so this is not just to scare you. And here on this platform we are providing you the videos for first year medical and paramedical. This I have never seen anywhere. You can find out anywhere if you found this kind of platform. In different platforms you can find guidance from 6 standards to NEET PG and IAS and all, but nowhere this kind of guidance is available, which is much needed. We have started from the first time here, and I wish this will be very much benefited to medical students, because we want to give society good doctors. You will pass, that's fine. आपके सीनियर्स भी बताएंगे कि बच्चे पास तो हो जाओगे, क्यों टेंशन कर रहे हो फर्स्ट एमबीबीएस से. यू विल पास डेफिनेटली, देर इज नो क्वेश्चन, बट you here you just not to pass, because पास होने के बाद पेशेंट सामने आएगा ना. इफ यू आर नॉट नोइंग एनीथिंग देन व्हाट हैपेंस, your impression will be gone in front of patient. Okay. So this is the thing. Huh. And another thing which I observed in my 17 years of experience is to for students, first year is toughest. It is like gearing up, initiation. एक गाड़ी एक बार चलना स्टार्ट हो गई, then it will run fast. So inertia, initial inertia is there. So if your first year is good, I can definitely say that the whole journey will be the best one. Okay. Now why? What are the reasons for that? So here also I have seen that the students, those who are scoring 100%, 99, 98 percentile, it becomes difficult for them to pass. This I have seen. I'm not scaring you, but just I am making you that vigilant, that don't do like this. Okay. So here, as I told you, we have started initiative in which you can get videos. So we have started our batch, first MBBS, or you can say first year batch. Not only, this is not only for first MBBS, this is for MBBS, dental, physiotherapy, nursing, okay, as well as your बाकी कौन सा रह गया, होम्योपैथी, आयुर्वेदिक एंड ऑल. We have started lectures from 1st January. You can go to our channel, that is Unacademy Future Doctors, and that is about Prof 1 and Prof 2. We have started live lectures, and if you cannot attend live lectures, then you can attend recorded lectures. They are also available. So you can attend this recorded lectures are also there in our this channel, so you can go and watch all these lectures. We have already started our first year. Okay. So if you have not started yet, then I request you, please start. Okay. Another thing, as I told you, that your seniors sometimes they tell you that अभी से क्या कर रहे हो, अभी रिलैक्स हो जाओ, आपका अभी तो फर्स्ट ईयर स्टार्ट भी नहीं हुआ है. बट why I am emphasizing you to start studies early. Why? Because first thing is your college is delayed now. This is high time. Your college has not been started yet. Okay. And once it will be running, or it will be running full fledged, then what happens, your faculties, they will complete their syllabus because it is their routine. Okay. But it becomes difficult for you to cope up with that speed. Okay. And second important thing that I would like to explain here is the situation is uncertain. COVID situation is uncertain. Nobody knows what will happen. Okay. Nobody knows next month what happens, whether you will be having live classes or you will be having online classes. Okay. And sometimes what happened in last batch, I can say you, our students were having online classes, but at that time they were given COVID duties. So suppose at 9 o'clock students, they have their class, but they have their COVID duty. So how can they attend class? In the second wave, those students, they faced that situation also. You can imagine what happens. So please, when it is routine, then it is not needed. But when the situation is tough and we are not knowing what will happen, so we have to prepare ourselves for the worst condition. So the situation is uncertain, and therefore I'm telling you to start your studies. Okay. Now some students say that why to subscribe? They have problem with subscription, is it? I'm not telling you that you subscribe and all, but the thing is, why subscription? I have the answer of that question. Why subscription? Because certain things, certain notes and all, we cannot provide on live videos. Okay. So for that, we require our app, and certain things we can upload on that app. And to run this app, we require subscription, nothing else. Okay, so this is the reason why do we require subscription. Okay, so this is all. We are running the app, and for running the app we have some expenditure. For that we require the subscription. Okay, and this is not very high. You can see that this is 1500 per month. That is, I think it is not very high. This is our expenditure which we are doing for running the app and the running the staff too. This is all about today's class. If you have any query, you can put the comment. Also, if you have any query, you can ask me here in the live chat also. Okay. So another thing, we have our classes daily at this in evening schedules. 8 o'clock I have my class. 9 o'clock Dr. Sheetal will also take. Okay, we have also Dr. Mona Lisa. Biochemistry also will be taken by Dr. Shivani. So we have all these faculties for first year. Okay, in physiology we have two faculties, Dr. Sheetal and Dr. Dipti. We two are there. For anatomy we have Dr. Mona Lisa, and for physiology, for biochemistry we have Dr. Shivani. Okay, so please at least watch this lectures. When will be the next lecture of physiology? Today at 9 p.m. Dr. Pallavi, hello. Dr. Sheetal will be having her lecture. In 1 week, we have this kind of strategy session. Tomorrow, I'll be having my lecture at 8 p.m. and we will discuss about skeletal muscle. We will discuss about skeletal muscle, and today also at 9 p.m. Dr. Sheetal will take the class. Okay, so be with us and you will definitely find it interactive and good. Another thing, another announcement also I would like to give you is that for my class, I can say that at every Saturday, Sunday, I have special class, not the live class. For joining me on the special class, you can download our app and you can put my name Dipti, and you can attend free class. This is free class, free special class. Okay, so don't, and in that class what I'm doing is, for the whole week what we studied, suppose we studied 10 topics in 1 week, so from all those 10 topics I will give you MCQs and short questions. So Saturday, Sunday will be our revision like class. Okay, so this is about our schedule, my schedule, I can say that, for physiology. Am I clear? Or any question, any doubt from your side? I'll give you 1 minute. You can ask me any question if you have. Anyone, please? Any question regarding your studies, regarding your doubt, you can ask me. You're most welcome. If you are watching me live, you can participate in the live chat, as well as if you are not watching me live and if you are watching recorded video, you can put in the comment also. We will answer you definitely. Is that clear to all? Okay, am I clear? Any question, any doubt from your side? You're most welcome. Ishu, hello, welcome to my class. I think you are late today, Ishu. What happened? Okay, now we are just ending the class. Okay, fine. Nice to see you after a long. I think you are here after 5-6 days or 10 days. Okay, so from tomorrow onwards, happy to see you all. Okay, thank you. If you like my video, you can like it. Another very important thing, please share with all your friends if they are. Issue, you are not well. What happened? Get well soon. Okay, share with KK, thanks, thank you very much. But please share with all your friends, all your colleagues. Hmm? Pallavi, Ishu, KK, all those who are with me, I request you to please share with all your friends. I would like to teach all of them. I'm very happy teaching all of you. Hmm? Please join in these free classes. These are for you only. And I'm very happy to teach you all. And if you have not attended any class till date, I request you, all these classes are available on our this channel, Unacademy Future Doctor. So you can go to that channel and you can watch all these videos also. Okay? Hmm? Okay, happy to see you. Thank you.